As John was saying, we're going to be talking about canine Stifle osteoarthritis, but I have found a couple of studies done recently with using laser, specifically before and after TPLO, which is great that there is evidence there on that specific use, because as you know, in animals, it is difficult to find specific uses for the conditions that we treat and we see so commonly. So to have that behind us, you can confidently recommend it to your patients and your clients, knowing that it is going to make a difference. So why MLS Class 4 laser? We'll go through that first of all. We'll go into detail about treating the stifle joint and the locations that we want to use, the settings that we want to use, and I'll go through protocols in both acute disease. So when acute disease, I mean acutely painful disease, really. So painful arm manipulation or flexion. Chronic disease, obviously, talking about arthritis, it is a chronic disease. It is a chronic painful disease, but there are different ways and maintenance methods to treat a joint that is, there's ongoing disease, but it's not as painful as it was at initial presentation. And then we'll go through a demo. After that, if there's time, I'll hopefully get through the couple of studies that we've got on TPLO, some studies that we've got on osteoarthritis in the elbow in dogs, which obviously can be used when we're treating the stifle as well. I've got a whole area on muscle trigger points that we might not actually get time for, and how laser fits into the multimodal approach, but we'll see where we get to. So what is MLS therapy? Photobiomodulation, also known as low-level, well, because it uses two different pulses, 905 nanometers and 808 nanometers, it is considered both low-level and high-level laser therapy. With the MLS laser, you've got those two different wavelengths. One is continuously pulsed, this one here, and then the other one can either be set to continuous or pulse, depending on what you're treating. So it's a painless, non-invasive, non-toxic, easily delivered in practice without any specialist equipment. It accelerates healing, provides analgesia, decreases inflammation, and there are, if you're using it according to our guidelines, there's no side effects to using laser. It is important to ensure eye protection to anyone in the room using laser, and either using goggles that you can get for dogs, or a towel over their head to protect their eyes, or just keeping their head away from where you're using the treatment. It has been patented to reduce pain and inflammation, and the way it works primarily is photostimulation of cytochrome C in the mitochondria. This leads to a cascade of events, increasing nitric oxide, so helping with angiogenesis and healing, vasodilation. It produces cytochrome C oxidase to increase the ATP energy needed for cell repair. There's also effects on fibroblasts, so to help with healing. There's increased reactive oxygen species to help as an antioxidant and those pathways. And there's also been shown to reduce inflammatory cytokines, obviously some of those specifically targeted by other COX-2 antagonists as well. So you get reduced COX-2 mRNA expression as well. So what are the benefits specifically of using MLS Class 4 laser? Because of the pulsed emissions, even when you're using it in point mode, so over localized areas of the stifle, you don't get any thermal injury at all to that area. So therefore, rather than just treating superficial areas, it's likely to it does penetrate a lot further into the joint and along all those areas that you're treating. So the effect is better. You tend to maximize results and stabilize the condition when you use it twice a week over 3 weeks, but I've still had good results using it once a week. It tends to be really good at reducing swelling of the joint, increases joint mobility. Because of the stimulation of collagen synthesis, it can really help with healing. And usually by the end of the 3 weeks, you can taper other meds, reduce non-steroidals, take away some of the, questionable other, certainly tramadol, there's question efficiency in dogs, whether that is effective at reducing the pain associated with chronic osteoarthritis. So the locations that you want to treat 4 points on the lateral side. You can see here the lateral side of the limb. You want to treat directly over the joint, and I will usually use point mode rather than scan mode because it tends to be more efficient, it's faster, and then, like I was saying about the penetration. You also need to treat on the medial side as well, normally 3 points on the medial side. While you're delivering the laser, you can also flex and extend the joint depending on how flexible the dog is, or if there is any swelling over that area and discomfort. If there are implants present, you need to be aware of where those are and avoid directly over the implant using the laser. The settings will normally be between, we get really good results between 4 to 8 joules per centimetre squared, but there is evidence out there that up to 20, even to 30 joules per centimetre squared might be needed in some of the more chronic, really, where there's a lot of bony change. You might need higher levels than we tend to use initially. So with acute disease, you'll tend to use an induction phase first of all. So you'll use treatment certainly at least twice a week for the first 10 days, depending on availability of when they can come into the practice. After that, it will tend to be twice a week for 2 weeks. And then usually after that, you can go on to a maintenance program. After this point, it's then worth starting with, other methods. So possibly hydrotherapy, possibly ideally getting them to an ideal body condition so they're not carrying extra weight. Exercise programs are much better then to start after you've done the initial induction, because they tend to be much better at that point and they're not put off by initial failure. When they can actually move that bit better with arthritis. Usually you can taper medications as well, which the owner is always happy about because they reduce their costs. Even though they're having the laser, they're reducing their costs in other ways. I was saying about directing away from the implants, it's because the amount that's then delivered to those areas, the soft tissue over those implants will receive a much higher dose. So therefore you reduce the intensity by 50%. I'll show you how to do that.
Is that because the light is reflecting off the implants? Is that the energy is reflecting off?
It reflects off the implants and those, so therefore you get a higher dose in those areas. Yeah, you don't get overheating, but you just need less laser than if there isn't an implant there. And equally, it's the same if you have pigmented skin. If you have dark skin, you need to reduce that. It automatically will reduce the intensity by reducing the amount just by pressing W or B for white or black skin.
And that's important to know, it's the skin rather than the hair, isn't it, that you're worrying about?
It's the skin rather than the hair. So most even black dogs will have unpigmented skin, but obviously there will be pigment. Sometimes if it is a really thick coat, you might need to, you might need to increase the amount of those, but usually it will do that for you automatically on the machine. So you tend to, the actual setting for chronic pain, it's actually the same for chronic pain as it is for arthrosis or arthritis, because arthrosis is chronically painful. So I usually will, if it's acutely painful, treat for chronic pain, 6 points over that joint, and then chronic inflammation as well, because there's usually chronic inflammation affecting the joint capsule and the cartilage as well associated with that area. Check for trigger points. If there is any trigger points in the muscles, you can treat those as well. I'll often, as a bit of a warm-up, sometimes treat muscles, particularly of the back and the hind limb, but often the paralumbar muscles in the back have been taking the strain of walking because there's been quite limited, particularly post-surgery or post a chronic cruciate disease. You will get significant muscle contracture of the muscles of the back. And once you can treat those, you tend to get much better movement in general. And when you're treating, obviously, then you're also treating the pain associated with the joint. You then get a much freer range of movement all over because their back is sort of freed up, in addition to treating the painful joint. So with maintenance treatment, when it's a chronic non-painful condition, I mean, I hesitate to say non-painful because obviously we know arthritis is a constantly chronic pain issue, but when it's not, you know, they're not crying out in front of you, then I'll tend to use them in the arthrosis setting if they're not painful on flexion. Over 7 points around the knee. I'll use muscle contracture setting and then again check for any trigger points around as well. And I'll do that on each of the each of the hind limbs, because often there's bilateral disease, even if they're not particularly lame on the good leg. There's often bilateral disease. At this stage, I'll usually use monthly treatment. There might also be other, you know, if they are on a weight loss program, it's good to check in with them every month as well, just to give them a bit more encouragement or adjust the exercise regime as well. So these are the areas that you want to be treating, and I think I will grab Merlin shortly. You can use after surgery, immediately on the day of surgery. You can do it while they're still asleep, as long as you've got hemostasis there, because of the change in angiogenesis. You want to make sure there is good hemostasis first. Particularly like 1 day or 2 days post TPLO surgery, I'll often use the edema setting in scan mode, because there can be quite significant swelling in the limb after, and it's often the swelling, I find, that the joint is actually not that painful, but it's the swelling around the joint that prevents flexion and use of the limb, which, you know, in a dog, if they're not moving it properly, then that will just cause the swelling to build up more. So no matter how many painkillers you give them, it can be a bit of a catch-22 situation. So the laser can be really good at relieving that swelling post-surgery to get them back to sort of, you know, ambulating. I think my brother-in-law is looking to have a hip replacement soon. And I think they get them standing now in human medicine, like the day after hip replacement. So, you know, I think the sooner we can get them back to gentle movement and exercise, the better for recovery. And just to show there that you're moving the hip, you know, moving the stifle, flexing it back and forth. So when you're treating it, to help maximize the surface area that you're actually reaching. So I will just stop this share for now. Right, so I'll just get this machine set up. And obviously you've got arthrosis there. So you can see you've got, it changes the frequency of the second pulse. And you can see it is exactly the same setting for chronic pain as well. Acute pain will be slightly different, but the settings are the same. So I tend to use chronic pain, and then if there is significant inflammation in addition, you can do that in addition, and you're still only treating at sort of 4 joules per centimetre squared over 6 points, so you can change that to 7 points there, and you can see that treatment then of chronic pain will be adding up to 7 points, will take less than 3 minutes. You can see here you've got your white, black colour code option. You can got small, medium or large. That's automatically set for 6 points. But you can just set, if it's a really big dog, you can set to 8 points and have all 10 and do 5 on the lateral side and 4 or 5 on the inside, depending on what you need. So that's there. We'll get back to the start. Time to put the glasses on. And your moment in the limelight, Merlin, is about to begin. If you're going to come up here. So I've got it all set on the machine. So all I need to do to start is just press the orange button. And you can hear the beeps as it's counting down. You just press that again and it stops if, you know, someone walked into the room. So you press again, you don't need to hold it down. And then you'll locate that in the areas that you need to.
They can feel very little at this stage, can't they? I mean, there's so little which they actually pick up on the sensation.
So, you know, just to demonstrate, you know, flexing, you might need, if you have got assistance, you can see I've just got my arm supporting his hind limb as I'm picking that up. But you can hold it flexed and then hold that into different areas. You can see I haven't got any glasses on Merlin, but I'm actually holding the probe very close to the skin, so there's no area for it to escape. And then putting that straight back down into the holder there. So even if I was to press that, there's no laser coming out into the room. It is quite a sort of reflective room here, so you do have to be aware of that.
And that would be like stainless steel tables and all of those things as well. It's just beware, worth considering.
And it will just count down, and then eventually when it comes to the end of the delivery of that area that you're treating, then it will stop. You'll hear the beeps, it will stop the delivery, and then you can reposition and then press the button again, and you can go then treat from the inside. So 3 or 4 on the inside, 3 or 4 on the outside. That's normally the areas that I'll treat. And then, so feeling for sort of areas of tension, you can tend to get it on the quads, just in this area. So, you know, just feel along the muscles and feel if there's a sort of a knot or anything there. And then you can just treat, there's a setting on the machine for trigger point, and then you'll just hold the laser directly over that trigger point. And sometimes I'll just hold it still, sometimes I'll just do a slight movement just like that into the muscle on that area, and it tends to just you normally only need to treat each trigger point once, and then particularly on the back here, that will be where there's a lot of tension going on just here with hind limb lameness. So I'll tend to use the
trigger point is when you have to have an owner in the treatment room with you, they can really see the response to laser by treating a trigger point. It's quite visible on the demonstration, isn't it? When you press that trigger point and you get a reaction, you treat it with laser once or twice.
Yeah.
Trigger point, and then
yeah.
they're not reacting to it. You can see that something's occurred with the patients. Relax that knot. So it's always a good thing to do.
Yeah, that's what I'll often do first of all, just as a sort of warm up and just to relax the dog. I'll often either treat with scan mode over the back or treat the trigger points, and then that sort of tension that's there will sort of disappear, and then it's quite then relaxing to just flex and bend the joint and treat with the laser as well. That would be really useful. So how long have I got? 5 minutes or so.
And not a single question yet, Caroline. So they're all.
Just very, very shy today. So yeah, we've got these 2 studies that were done with looking at TPLO. One was just with actually a pre-operative treatment. So it was only treated. They only actually treated with laser before the surgery. There was 1 laser treatment at 3.5 joules per centimetre square, or sham treatment, so that would have been the red light only, immediately before surgery. They did lots of different assessments of lameness, manipulation response, radiographs before and after, force plate analysis, which is thought to be the gold standard of assessments. There was reductions in a lot of, after the surgery, obviously, we would expect improvement with the surgery. So there was that in both groups, the laser treated group and the non-laser group. There was differences, improvements in the lameness, but not statistically significant. They had 27 dogs, so there was, I think, 12 in one group and then 15 in the other. But of the one that is the most qualitative rather than quantitative, did I get that the right way around? The force plate analysis is the one, and there was improved limb function in the dogs that had just one single laser treatment. Obviously, we tend to recommend a lot more than that to maximise the benefits. You tend to get additive effects when you're using the laser more than once. That's been shown in people as well as in animals. And that was at 8 weeks. So the other one they looked at was a much larger study, 95 dogs in total of a variety of different breeds with naturally occurring disease. They all were scheduled for TPLO. I think it was single joint that they were looking at rather than bilateral disease. It was a randomized placebo-controlled clinical trial. There were 3 infrared or near-infrared laser treatments given in the 4-day post-operative period, and the placebo had red light only treatments. And by owner questionnaire, there was an improvement in the owner assessment of gait at all those levels of when they were assessed post-operatively, the canine orthopedic index. So that was really, really positive effect. So, even if you're just using it post-operatively, you know that there is significant effect there with using the laser. Just I'll mention, obviously, the pain scoring. There's a few different options. It is something to consider starting to use in practice. A lot of them you can just download. You can get the owners to fill them out even before the appointment, or while, I would say, waiting in the waiting room while they're waiting in the car before they come in, or before you see the dog. And it does really help because I think these sort of more formal assessments can really help to build a picture, because we're lacking that discussion that you can normally have with the owner in the clinic now, because we might be sheltering under an umbrella and you might not want to go into great detail about can it still climb the stairs or what the level of mobility is. So the Liverpool scale tends to focus on mobility and movement. The Pennsylvania study more tends to focus on pain. So both of them have their place. Those are the 2 that I would recommend starting to use. They're both complementary, they're repeatable assessments. Obviously, they are still subjective, but I think it can really help to have a standardized. I mean, whether you do this already before and after you're using non-steroidals, it's something, it does help to sort of involve the owner a lot more in the assessment, which a lot of the time, or, so posting videos, obviously it's quite useful to assess those now. But I'm finding that when I do see the animals now jumping out of the car or struggling to get back in the car, that's actually more valuable than, how before, when they sort of just used to walk into the consult room, you might actually see now in the car park, I'm doing far more lameness assessments in the car park and trotting up and down than I ever did, 12 months ago. So I've discussed these previously about canine osteoarthritis. So there's a couple of different studies that were done looking at naturally occurring disease in the elbow. There was this study that compared the use of the amount of non-steroidal given, basically with or without laser treatment and hydro, and there was in nearly over 80% of the dogs in the treated group with laser, they reduced the amount of non-steroidals. There was a good little study there about the dosing guidelines and things. It's quite useful for reference for. That was only done last year. And this other study was done on the articular degenerative disease, and it used 16 Labradors with naturally occurring disease, so it just was shown in Labradors rather than other dogs. And this study had, rather than having one laser and one without, this had one laser without any non-steroidals, one with non-steroidals only, and then compared, obviously they did have, you know, treatment with the Rimadyl for 2 weeks, and then with the laser they did have treatment for 5 weeks in a reducing amount each week. So they were assessed with both those different pain scoring methods at day 0, after the painkillers, at day 15 and then day 45 as well. And the degree of lameness did decrease in both groups, and there was no difference between them. So, you know, it does show that there is evidence there that laser is as effective as non-steroidals in reducing lameness. There was also an improvement in the laser group compared to the non-steroidal group. Okay, bear in mind the laser did then, the painkillers stopped at week 2, but ideally we don't, if we can avoid long-term medication if at all possible. There was actually persistent pain reduction, inflection and extension, and reduced number of trigger points at day 45 in the laser group, compared that didn't happen in the non-steroidal only group. So I don't know how much people know about trigger points, but this is sort of a way of sort of identifying them. So they can be quite painful. They're hyper-irritable areas within a taut band of the skeletal muscle. You can find them sometimes with a flat hand if you're looking over a large body of muscle, or if it's in the hind limb, you can just pinch them between your thumb and finger to find them. And I think each treatment on the trigger points is about 20 seconds with the laser, and that tends to resolve the issue. These are the common places that it occurs in the hind limb. So any form of hind limb lameness can result in trigger points in these areas. So particularly the quads.
Oh, no, my dog was sadly gone now, but when he was around, he would always get a trigger point in a particular location. It was regular. I got to the stage where I could just put my hand exactly right on that trigger point. I had the benefit of having a laser in the back of the car and demonstrating. Yeah. I just knew that I could get it out and treat it, and it just used to make it so much more comfortable so quickly. Yeah. Yeah. But he was left elbow arthritic, and the trigger point was on the right hand side of his spine, just in front of the hips. And touch it straight away. Knew exactly where it was, always in the same location. So you teach your owners to find them. If they start to do an assessment a month or 3 weeks after their last laser session, they can find a trigger point. They know that their animal is experiencing pain again.
Yeah, and it's something that exactly that owners can find out. You know, or this is where he was painful, or you know, show them, and then look, this spot isn't painful anymore, but it might happen again. Because we know, obviously, with the chronic nature of the disease, to have a feel of your dog and get them involved in identifying exactly where the pain is. And then they can obviously then get treatment as and when they need to. I mean, often, you know, you can see dogs, this is more of an indication of the contracture of the muscle in the thoracolumbar areas here, this picture. You can see how far back, how much forward the weight is being shifted. I saw a dog yesterday with complaining of she was worried it was tripping on its front legs and falling on its foreleg, and it was a little bit lame on the left fore, but actually when I then examined it all together, I could hardly extend its hind limbs at all, and so it was probably pain from the back end that then is driving, and then it's falling over at the front because it's trying to limit how much work is going on in the back. It's a natural thing that happens, you know, that they get this kyphotic stance because they can't flex the hind limb or even, you know, move the hip forward. So because of that, you get this sort of sway then sometimes as well, and they're using other muscles to get forward motion. rather than using the muscles that are there, because when they move the muscles that are in the back leg, it causes pain in the joints. So so yeah, with the laser, it tends to specifically really help these trigger points by reducing edema, helping the microcirculation, oxygenation of tissues, just getting that muscle working as it should do again. Basically, really effective. Then I put up a sciencey slide to actually show, you know, where they've shown that there's an increase in protein PP1 and phosphatase there, which will help the calcium pump. It's also, you know, ATP dependent. In a trigger point, you tend to get decreased ATP, so the laser will increase the ATP available in the cell to help with those end plates and just get the muscle moving again. So this is why it works. So just to round off then, in terms of, you know, it's all, you know, it's all about trying to help prevent the loss of joint mobility and maintain a good level of exercise so that you don't start on that downward spiral. And often, you know, owners will have already thought about this and perhaps gone for hydrotherapy, or, you know, so those you know, requests you get for, oh, can you please, you know, we haven't seen the dog for 2 years, and then they're requesting, oh, he's getting a bit stiff, can you sign him off for this hydro? And actually it might be worth getting them in to see them. Not necessarily, they might be before they need a long-term course of non-steroidals. They might not need that. That's often what the vets will reach for. The owners don't necessarily want that, because they don't need just the painkiller to stop the pain. They need something that's going to help, you know, the physical, you know, where they are now. All too often the vets will just reach over for the non-steroidals. Now that's not working anymore, add in another tramadol and then get some gabapentin and everything else that we've got these days, which is great. We've got these options, but actually I'd argue for those ones that are sort of before that, or the ones that are and you know, you hopefully seen them at least every 6 months, if not every 12 months, getting them back into the practice, having an assessment, seeing where the pain is. Have they got muscle pain? Is there reduced strength of the muscle? Is there lack of joint mobility? Have they had previous surgery but now the other limb is affected? So that's where MLS laser can really help to motivate you and the owner to, you know, really, there's something that you can do physically that isn't more medication, which often the owners are quite reluctant to start down that road. You've got all the x-rays. I did a demo a few months ago. I think it was one of the last ones I did before lockdown, and they had this dog brought in, and he was about 12, and then they said, oh, these are his x-rays. And I was like, oh, right, that's interesting. Oh, I think the date's wrong on here. It says, you know, 2005. I was like, oh, no, they were like, no, that was his elbows in 2005. And he hadn't had x-rays since, but you could just imagine that they're pretty bad, because they were not great, you know, in when they were taken. So, you know, just to, you've got that evidence there, so you know what's likely to be going on within the joints, you know, 2 years later, 4 years later, 6 years later. Normally, we'll have the vet nurses running these clinics. I know a lot of the vet nurses are really, we're struggling with sort of people at the moment, and you know, time is limited, but often, rather than the veterinary nurses doing, say, the weigh and worms, if they can be a bit more engaged with the animals and be doing these physical treatments, then that can really help with their motivation as well. So I would suggest introducing the pain scoring before and after. That will really help. And it's great laser, really, because it will drive that increased patient interaction, build further strengthen your client loyalty. It might well be that not every practice is offering these extra opportunities there. Helps with practice revenue, obviously, but most importantly improves patient outcome, which, you know, and you know, people are always keen to try and reduce, if there's things they could do to reduce the amount of medication they're giving their dogs, then they're really grateful for that opportunity more often than not.